In this video, we will be discussing soft tissue techniques for the foot, ankle, and calf. Runners often complain of foot pain, specifically novice runners who attend fun runs but do not run very often. This can include anything from tendinopathies to plantar fasciitis and other forms of somatic dysfunctions. The foot, holding most of our weight, is a common place for somatic dysfunctions to present, so it is very important we learn how to address them. We can start with a quick active assessment. It can be helpful to have participants remove their shoes and have them stand barefoot for your assessment. You can assess presence or absence of an arch, as well as inquire about if any pain is present statically and where it is present. You can also check for internal or external rotation of the feet. You can also put the participant in uniform base and check those markers again. A toe touch is helpful to analyze the posterior line fascia. The posterior line fascia tracks from the plantar fascia all the way to the top of the head, and a dysfunctional toe touch can give you a hint whether any plantar fascia pain is linked to tight hamstrings or tight lumbar fascia that you can be sure to address. So keep in mind that pain of the foot may not be the fault of the plantar fascia. It might be a more proximal connection that is causing the issue. You can also have the participant stand on one foot, watching for how much side-to-side movement happens and what happens to the foot when they shift. You can check for how much the foot grabs into the ground while in single leg stance. You can also have the participant do a squat while watching the feet for any changes in internal or external rotation and any changes in arch. This sort of dynamic testing can be a helpful hint as to whether there is a static or dynamic dysfunction, or both. This means the problem might be absent while standing, but it might reveal itself during movement, and these dynamic dysfunctions are very important for athletes as they are exacerbated by significant movement, such as a long run. You can also do a gait assessment, looking for the same markers as before. Again, the dynamic dysfunction might only reveal itself during movement. Next, you can have the participant lay on their stomach, so you can start with a passive assessment. You can test internal and external rotation here, being sure to keep the knee flexed at 90 degrees. You can also test plantar flexion and dorsiflexion, as well as pronation and supination. Now we will begin discussing techniques for treatments. The first technique is to bring the participant in and out of dorsiflexion and plantar flexion, supporting them the whole way. You want the participant to feel secure in this position, especially if they are experiencing pain, so be sure to hold their foot with multiple points of contact. Next, we can do an effleurage, starting from the Achilles tendon going up through the calf. You will want to use lotion, especially if there is leg hair. This is a great technique for before or after the event, and as we discussed before the event you will want to give lighter contact with quick movement, but after the event you will want to give deeper contact with a slower flushing motion. Be sure to give the Achilles tendon a light squeeze at its insertion at the calcaneus. This feels great for the participant and it provides a lot of relief. If you bend the knee while you do this technique, you will shorten the gastroc but keep the soleus lengthened, and you can target the soleus a little more specifically. You can also do some cross fiber work by starting from the lateral side and moving up onto the gastroc. You will want to go faster and stay more superficial for this technique. This one is great for a pre-event warm-up. If you find a specific area with a lot of tension, you can add a tack and stretch. This is where you provide some inhibition with one hand while pulling the foot from plantar flexion, which is shortened tissue, to dorsiflexion, which is lengthened tissue. This can help with improving movement at the ankle joint and also provides a lot of relief for the participant. Be sure to not put too much pressure if it is distinctly painful. We can also do some soft tissue of the plantar fascia specifically, being sure to start light and move deeper as the participant becomes more comfortable. Be sure to again put a lot of emphasis on the calcaneus, again at the plantar aspect of the foot. You can also add a tack and stretch here, moving the toes into flexion and extension while keeping the pressure on a specific area of tension. An extra optional pre-event technique is some oscillation of the tissue. You can start by shaking the leg at the foot and then doing some quick effleurage back and forth. This should help them get warmed up and ready for their event.